Welcome, everyone, to the Building Community Power to Advance Policy and Systems Change. In case you were with us back in June, this is a repeat session. We made some slight modifications, but it mostly is a repeat. So we're hoping that you didn't have any trouble joining today, and we're happy to reoffer this workshop for those of you who did have trouble joining. I'm happy to be here today with my colleagues, Samantha Lasky and Jasmine Deskins, and also we have a peer presenter from Egyptian Health Department, the administrator, Jamie Bird. Jamie will be joining us shortly, so we are looking forward to hearing from Jamie. And I just want to make sure you all notice that this training series is made possible with funding from the Illinois Department of Public Health through the Community Health Assessment and Planning Grant for 2025. So we're appreciative of the Department of Public Health for that support to provide training to you all. We sent out the agenda in advance, and you'll see that we're going to break halfway through the 2 hours that we're together. So you'll have a time for a bio break or to catch an email or phone call if you need that. We're also going to do several polls, and we have two really interactive breakout discussions planned. So we'll want you to be as involved and participatory as possible for those. That's really where the learning takes place, and we hear a lot of folks say how valuable those are. So we hope you'll be able to be present for those, and also during the breakout groups, if you'll turn your video on, that will be great. Our learning objectives for this session are to really define, describe policy systems and environmental change strategies and how those are different than programs, why those are important. We're going to just talk about how local health departments can build power within their communities to advance policy systems and environmental change, and work on applying some methods for community power building during your community action cycle of your IPLAN. We've established group agreements that we use for all the trainings, and we're hoping that you all can stay as present as possible. We know time is precious, and we appreciate you giving the time here. There's just so much content that we want to share. Make sure you are sharing, and in your breakout groups, you're allowing space for others to talk, as well as, really stepping up and taking space, and trying to understand different perspectives. We all come from a different place. We might have to move things along quicker than it feels comfortable sometimes to get through everything, but we can also parking lot things if we don't get to them, or there are questions that you all have. We can come back to those later or follow up after the training by email. So don't hesitate to ask any questions throughout. Put them in the chat. My colleagues will be capturing them for me. I won't be able to see them in real time, but they'll interrupt me if need be, or we'll pause periodically, and I'll see if there's any questions that we can answer at that time. We've got some poll questions, including our evaluation is by poll. So please participate in that, because our funders and IDPH's funders require that data. And so we really want to make sure we're capturing that and able to report that. Is there anything else that y'all need to make sure that we have a successful learning experience? Please type that in the chat, and my colleagues will let me know. We're getting ready for our first set of poll questions, and there are 2 questions in this poll. So if you'll take a look at the screen, we'll be broadcasting the poll. You'll scroll down on the sidebar to make sure you can see both questions and just answer both of those questions for us. I'll just pause for a minute while you do that. Looks like we have about a little over 50% taking the poll. If we can get a few more responses, I think we can probably report those results out now. We're about 70-some%. So we'll end that and take a look at the results here. So it looks like we have a good mix. 29% of you are reporting that you've been involved in some policy development change, and 64% systems change, and 7% environmental change. So not as much environmental change, but definitely a good mix there. And when we're looking at how comfortable you are leading those types of initiatives, we've got some across the board. Few folks are not comfortable. This is probably newer to you, and somewhat comfortable and comfortable are tied at 36%, very comfortable at 7%. That's great. We're looking forward to hearing all those experiences in the breakout groups. So thanks for that. Gives us a good idea where we're starting from. So I'm just going to start us all at baseline by looking at what policy systems and environmental change, or PSE, is. You'll see that term a lot. So that's what we mean when we see PSE, policy systems and environmental change strategies. And we're defining policy change as the passing of laws and ordinances and resolutions, mandates, regulations, rules. They can be written and adopted at the federal, state, municipal, or organizational levels. And organizations, departments of states, they also have, of course, policies. All federal government has policies. And when we're talking about across maybe something like schools, you can do change, a policy change in one school, or maybe all neighborhood schools, all city schools, all state schools. So it can be at all different levels, and policy affects all those different levels. And if you're working even at the smallest level of policy change in one school, that's still a policy change strategy. So you'll see some examples on the screen here. Legislation at the state level or federal level that provides financial opportunities or incentives, like child tax credits. Another level is written agreement for a peer-led student or nonprofit mental health group to have meetings and use space at a local school. That would be a policy that would allow that. Reallocation of school funding from police to social workers or to school-based mentors or something like that. That's another policy change. So those are some examples. And as you hear some of these examples, you might say, oh, I've done more work in that area than I thought I had. Next slide here. So there's also big P and little p policy. When we talk about big P, that's usually the distinction between, the big, broad, overarching policies, maybe the federal or state policies, your county government policies. And then little p policy are usually smaller, more localized or operational policies. Your health department probably has organizational policies and procedures. Big policies are, like I said, typically government and their laws or regulations, while the little p policies are often, found within our communities or our organizations. They might be institutional norms and organizational practices. And you'll see some examples of the difference between big P and little p here on the screen as well. Sometimes our little p policies are easier to influence at the local level, sometimes not so much. But sometimes those are easier, and that can often be a way to create snowball efforts where we start small and then we move to statewide and then nationwide. So that's the way change, of course, can happen sometimes. Systems change are changes to unwritten rules or processes of an organization, institution, or community. These changes really impact all areas of an organization, institution, or community, and they work hand in hand with policy change. So we don't often see policy change without some sort of systems change. It's really working to address and improve how systems interact with one another as well. So some examples here might be a local community-based organization and school partnership and collaboration to create easily accessible mental health referral process. Another might be a network of organizations and agencies that work together to address mental health issues and emergencies that go beyond having non-emergency or calling the police. So having non-emergency 911 calls redirected to a mental health crisis team is a good example here of that type of of systems change. And then we will move on to the environmental change. These are changes made to economic, social, or the physical environment, and they can address challenges like access to stable, well-paying jobs, people feeling safe and secure in their neighborhoods, noise pollution, being able to get a good night's sleep because of preventing noise pollution, calming spaces in the environment, all sorts of things. There's additional examples here on the screen: affordable housing in our neighborhoods, healthy food that's accessible, and more green, walkable, bikeable communities and spaces. So those are the definitions and some examples of policy systems and environmental change. And on this slide, you'll see we're looking at the difference between program approaches and policy systems and environmental change approaches. And in this case, I've classified these by different settings. So for example, what you'll see here in this table, it shows how to showcase the differences between that traditional approach of programs to more of a PSE approach. And in this set of examples, it's focused on mental health. And these are programs and events versus a more transformational approach, which we would call PSE approaches. So in the community setting, for example, in row 2, a program or event might be co-hosting a mental health resource fair. And those are a lot of times things that we are asked to do or we're part of. But a PSE strategy that might be more impactful would be coordination of a mental health network, so that every touch point that the community has, whether it's school, church, hospital, food bank, is all streamlined, and advocates are for root cause solutions are working together, and they're providing those referrals and connecting, so people are connected to all those referrals throughout and to those resources throughout those services. So that really shows you how the difference is here, rather than putting the onus on individuals to get the information and act on it. We're taking a systems approach and changing the system to better serve and meet community members where they're at or where they are, and we're meeting all of many of their needs that address underlying causes of mental health issues. So you can see here the same goes for other settings, work site. Instead of holding health screenings for staff, which is certainly a good and nice thing to do and helpful, a policy approach would be making sure that jobs and positions have access to health insurance, and that will cover mental health services or the types of things that they need. So in addition to a yearly cost of living adjustment, we're making sure that jobs also have the benefit of insurance and affordable insurance that folks can have, or that we're making sure that people are getting signed up for insurance. So those are some examples. There's a hospital example, there's a school example, but I won't read those to you, or I'll leave those for you to take a look at later. And we're going to do another poll question. So if you have tuned out for a minute, tune back in with me if you would. And our poll question here is, why are policy systems and environmental change strategies so important in public health? So just take a minute and let me know your thoughts. No right or wrong answers here. We'd love to hear your thoughts on why these strategies are so important in public health. I think it's important that in public health, we do more than programs. We implement policy systems and environmental change strategies. We work with others to lead these.
We've only had about 3 responses so far.
Don't worry, we are not calling anybody out. Your answers are all anonymous. Okay, let's see what we have. I know we don't have a lot of responses, but for the sake of
Mm.
time, we'll see what we have here.
Sounds good. It's loading. Mhm. My apologies. I don't know why it's taking so long.
Are you able to see any of them, Samantha?
Yeah, the Zoom is just taking a minute to load. It's pulling up now. My apologies for the delay. Okay. Wait. Oh my goodness. It's not coming up. I'm so sorry. It keeps redirecting me. Let me try this again. Okay, there we go. Okay. Gaining the support of organizations and local government and municipalities to work towards public health goals. It's important because it lays the groundwork to achieving desired goals, gives them guidance to the future, can help or hurt the community if not done correctly, makes sustainable change leading to healthy outcomes for people. It supports efforts of programs, makes a difference, equity in services. We need to start making a difference in root causes. And you can't teach someone to eat healthy if the corner store only has junk food and that's their only access to food. So leads to sustainable changes.
Those are great, great responses. Thank you, everyone, for that and your patience there. I had a few items from community comments that I put on a slide here, and I think you covered pretty much all of those, addressing root causes, prevention, improving population health outcomes, advancing equity and sustainability. Ultimately, PSE strategies help create healthier, more equitable, and more sustainable communities. And someone said that they can cause harm too. So we do need to pay attention to what the impact assessment, health impact assessments, what's the potential impact, what are unintended and negative consequences that could occur. And these are particularly why we need to make sure we're engaging community and policy systems and environmental change so we can understand from all different types of perspective what those potential impacts are. With addressing root causes, many of the PSE strategies can help address things like poverty and racism, things that, a single program or different programs aren't necessarily going to address. Prevention, they can, be preventative uh, in the focus so that we're addressing problems before they start, whether that's promoting healthy eating and physical activity through the policies and systems and the way that food is provided to many other things and regulations on tobacco, things like that, to prevent people from starting smoking or continuing to smoke. Improving population health outcomes. So, by improving things like access to healthcare or making healthy behaviors the easier choice or reducing exposures to poor environmental hazards, we can positively impact health outcomes for whole populations and not just a few people, but we can make those population level changes. And then with advancing equity, we are addressing those underlying social and structural determinants of health like poverty, racism, discrimination, so that we can have a more just and equitable society where everyone has the opportunity to live a healthy life. And finally, a few of you mentioned things related to sustainability, and PSE strategies are inherently more sustainable than one time or intermittent programs and interventions. They're more lasting, they can endure over time. They do need improved over time, and if they do need enforced, right, there are other pieces to that. but that is part of the systems change as well, making sure those pieces are involved. So the impact of PSE changes are strengthened when they're implemented through a collaboration or collective action, and when community is engaged. So we want to have that cross-sector involvement in these policy systems and environmental change so that people buy into them and that all perspectives are included. And that programs really can help build support for policy systems and environmental change and the adoption then of new healthy behaviors. So how do we advance equity? Because that was a big piece in the previous slide also. It's really through addressing social determinants of change, so changing those community conditions. It's through addressing the structural determinants of change, which are transforming the written and unwritten rules that keep those social conditions in place that are negatively impacting some folks. And we're shifting power relations or building community power. We're breaking power of those who maintain the status quo and who are keeping some of those negative conditions in place. So that's really the focus of today's training is how do we focus on policy systems and environmental change? How do we build community power for that to happen? Part of the rationale is because of the social ecological model that public health issues are complex, they have lots of layers, and we know that various factors influence it, from individual behavior all the way up to the laws that are set in place. One of the many reasons that interventions feel lacking or programs feel lacking is because they often focus solely on the individual or maybe that second ring, the interpersonal level. But as you can see from this image, and many of you already know, that we have much more than that. We have the institutional layer, the community layer, and the policy layer. And if a lot more of our efforts fell in those larger circles, we will have a longer impact on the root causes of what we're trying to address. We know that research suggests that most Americans believe individuals can control their own health outcomes if they just make healthy choices. And focusing on the center and the smallest part of the social ecological model, this individual piece, that's not enough. We know that, but the larger society often has a belief that just focusing on that individual or possibly even interpersonal is the way to go because we just need to influence behavior change. But we know that it's much more than that through our years in public health. And here you can see that county health rankings and roadmaps at the University of Wisconsin Population Health Institute, they have evolved their 2014 model of health to this new 2025 model that you see on the right side of your screen. So while health is often understood to be an individual experience by the larger societal members, the new model specifies the focus on population health, the distribution of health within a community, and the connectedness of our overall well-being, including quality of life and the length of life and the years and the ability of people in communities to contribute to the larger world. County Health Rankings and Roadmaps University of Wisconsin Population Health Institute has added to the model to reflect this new evidence base of what contributes to population health. So you will see community conditions added here, safe housing, jobs that pay a livable wage, well-resourced schools are among some of those conditions that create a healthy community. So the new model describes how society's rules, both written and unwritten, create those community conditions. And community conditions sharpen the concept of health factors from this 2014 model on the left side of the screen to better reveal the conditions needed for healthy communities. They just don't occur by chance, right? They're created by the policies and systems and social norms that are in place. Societal rules is another factor in the new model. And the new model names societal rules as the written or unwritten rules and how they're applied by people who wield the power and shape the community conditions. So, written rules may be formalized and documented in laws, policies, regulations, and budgets. Unwritten rules are made up of worldviews, culture, norms, what people think, the narratives that people hold. And by naming these rules and where the power is held and the narratives that people have, we can really work on impacting those in power to make positive changes. The third area is power, and the new model names power or the ability to achieve a purpose and to be able to affect change. So that's how we're defining power, is the ability to achieve purpose and to affect change. And power is what's used to create and maintain societal rules to keep those things in place. So people can build community power when they organize and act together to set agendas, shift public discourse, influence who makes decisions, and cultivate relationships with decision makers. So that's why our relationship building and the networks that we establish are so important. Even with people we don't really like or don't agree with, building and establishing those relationships so we can have some influence. So the new constructs of the University of Wisconsin Population Health Institute model of health reflects the latest evidence and theory that shapes health. And there's a focus on health promotion and harm reduction, focus on climate, and civic and community resources, in addition to the other factors that were included in the previous model. So if you have any questions or you want more research or information on that, I really encourage you to take a look at the website. I know County Health Rankings and Roadmaps isn't funded as an assessment any longer, but they do have some really great webinars and trainings on the model and framework and how that can be used. And it's a great teaching tool for people in your community as you're bringing them along. So one of the things that I mentioned in there was really shifting the narrative and how important it is for us to build relationships for transformational work and shift the narrative with folks for transformational work. It's absolutely essential to be able to move from this individualistic view that everyone can control their own health to a more population view. That's the narrative that we're trying to change. So in order to have more of a population view, we want to be able to create healthy environments, improve systems to be more effective for all, to work in unison, and advance and support equitable policies. So many people at that decision making level who hold the power consider most of our health disparities personal problems. And that leads them to believe that education, hard work, discipline, self determination, the pull yourself up by the bootstraps is the only strategy that's needed, the only solutions. Not that the conditions that inhibit people from using education skills necessary to engage in healthy behaviors are also a focus. So all of you in the public health field, all of you in the health departments who know this, I'm sharing these slides and this as tools that you can use as you're working with others to help shift that narrative. You know this already, and you know that the conditions where we work, live, play, pray, they're all shaped by the policy systems and environment and norms of our community. And we need to be able to engage community members, engage policymakers, build power to be able to shift those. And if we are ignoring and dismissing the systemic barriers, we're not going to be able to create the changes that we need and really be able to see the population health outcomes that we're trying to make. So to be successful in improving conditions related to health issues, we need to not only recognize that surroundings shape and impact health, but what's invisible, like the environment, everything, the air, the water, the norms, all of those things that we don't see. It's the water that we're swimming in that we don't even see. And we have to be able to shift the message about how important that water around us that we're swimming in is. And I'm using that as a metaphor. But we also know that we need clean water, right? So narratives are really, really important. They're values-based meta stories that about how and why the world operates, and they have the ability to shape public consciousness, including our collective sense of responsibility and possibility. I really recognize this even more so just recently when I had to testify on behalf of a funding initiative that was being considered, and hearing all the people that came before me testifying and understanding how important that narrative piece was, and personal stories integrated into that narrative to make an impact, to shift perspectives. So it really hit home for me when I was practicing that exercise. It's just simply unreasonable to expect that people will change their behavior easily when there are so many forces in the social, cultural, and physical environment that conspire against such change. And that's from the IOM in 2000. Do a quick time check here. Okay, so I've got a very quick story that I want to share with you, and you all are probably familiar with this story, but I want you to know that you can use this as a way to help educate folks in your community to understand why we may need to move away from some of the programs we do and instead focus more on policy systems and environmental change. So when you're thinking about this, think about how you can use this to shift narratives around what we focus on. So there were once three friends who were out fishing downstream in a river, and suddenly they see a person coming down the river in the water, struggling for their life. They can't seem to swim. They're, in distress. So the friends put on their own little rescue mission and pull that person out of the river. And then along comes another person down the river in the water, and again needs to be rescued, and then another and another. And this just keeps happening all afternoon. And the three friends who are on the sidelines, they're getting very tired from constantly pulling people from the river. They're putting themselves in danger. And while two friends keep pulling people out of the river, one friend decides to walk upstream to see what's going on that's causing so many people to be in the river and in distress as they're floating down that river. So when they arrive, they find that people are drawn to the edge of a little cliff that helps them look out, and they can see this absolutely beautiful view. And there's no safe way for them to see this beautiful view without standing in danger. And what they can see that while people are standing there, they're clearly falling over when they're trying to see this beautiful view. So the friend quickly runs back to their truck where they happen to have, what we all carry around in our trucks, if we have a truck, a big board and some spray paint. And they spray a sign warning people of the danger of the cliff. And they put that sign up. And while some people continue to fall into the river, the number decreases. That's good, but it's not good enough as there's still some people falling in the river. And so they need to come up with another intervention. And they head back down to their friends and tell the others what's happening. And together they go to the community leaders and inform them that, too many people are falling in. We put a sign up, but it's not enough. And so they decide to build a gate. So people they can view it safely, but they can't get past this gate where it puts them in danger. So in this story, it highlights the differences between programs and policy and environmental changes. And instead of spending all of our resources on a program that rescues people once they've fallen in or educates people that it's not safe, it's important to actually change that environment to make it safe to view the water. So this is not to say that those programs didn't have some effectiveness. They aren't important. The combination of the sign and the gate is great. And also having people at some point who can rescue folks who do still get in there, they're all important pieces. But the simplisticness of this story, it can really be helpful in opening eyes, but it won't be the end all be all to shifting the narrative for those in power. We know we need to build community power as systems and environments are shaped by power. So hopefully this simple story that I'm sure you've heard in different ways many times over the years will be a good reminder of something that you can use. I'm sure you're a better storyteller than me too, and help demonstrate that. So I just want to bring you back to this slide on shifting the narrative. We've got the individualistic view of downstream and the population view of upstream. We're trying to shift that view to say we can't keep simply focusing on the individualistic view. We've got to focus on the upstream as well and the population view so that we're creating the environments and the conditions, the systems, the policies that will create conditions that support the healthy choice, that will support healthy behaviors. So we're going to pause here and jump into our first breakout session and hear what's some of the work that you've been doing in this area. Later, we're going to do a breakout group specifically related to narratives. So for this breakout group, we're going to take 10 minutes in our breakout groups. We're going to have small groups of 5 or 6 people in each breakout group. So please think about the fact that if there's only 5 or 6 people, you all need to be present to make that group effective. You might want to take a photo of this screen because these are the questions that we're going to be using and you could refer back to them. But we're also going to copy and paste them in your chat. I'd like to have you ask for a volunteer. There's only one question that you really need to focus on. What are some examples of policy systems or environmental change that you've worked on in the past or are currently working on? And what was successful about it? Or what were some challenges and how did you overcome challenges? If you don't have any examples, you could share what's a policy system or environmental change that's needed in your community and what's keeping you from getting involved in that or starting that work. What do you anticipate to be challenging? So we're going to need either a volunteer that's going to start off that discussion, or you will choose the person who's at the first name at the beginning of the alphabet to kick that off. And we're going to need a volunteer who will report out a few of those examples and some of those common challenges. And if you don't have a volunteer, the person whose first name is at the end of the alphabet will do that report out. So Samantha, and Jasmine, how many breakout groups are we ready to do those with 5 or 6 people in them?
Yep, we've got 4 rooms with about 5 or 6 folks in them.
Okay, and we're ready to copy those questions into the chat and
They're
bring
in there.
people out? Okay,
Yeah.
let's go ahead and move, folks.
Okay, breakout rooms are open.
I know that the questions don't follow, the chat doesn't follow them. So we do have to copy it in each breakout group chat.
Yes, I was going to go do that now.
Okay.
Okay, I'll start with room 1.
And then I'll start at the bottom of the list if you want to start at the top of the list for checking in on groups. I'll give them a minute to get going. Oh, mercy, I'm trying to copy these questions.
Yes.
We have a template.
Lori?
Yes. Jasmine, go ahead.
Oh, I saw you back here. I didn't know if you needed anything.
Oh, no, the groups seem to be. We still have a few folks coming back from breakout?
Yeah, about 30 seconds left.
Okay,
I think I need to change closing breakouts to 30 seconds instead of 60.
yes. Yeah, that would
Yeah.
be good.
15 seconds left. Great. Everyone should be just about back.
Great. Our numbers look like they're much lower. Well, welcome back, everyone. I hope you had a great discussion. How about a few examples that you heard? What are some examples of PSE strategies that are going on? Anybody from group one want to share anything?
We group one. I don't know what group I was in.
Oh, that's okay. If you were a reporter, just pipe up and we'll hear from you.
We'll go first. This is Amanda, Jamie, Tanya, Ellen, and John. And Tanya was our group reporter. Thanks for representing us, Tanya.
Yes, no worries. So kudos to the team because they were the ideas. I was just the note taker. But there was ideas mentioned such as smoke-free Illinois. The county came up with food ordinances, and if ordinances weren't followed, they would potentially pull the permit to help reinforce. There was examples of rental ordinances and possible acts to register for housing safety. There was mention of the lack of affordable housing. Then there was examples given of signs to clarify no smoking, and then the difference between vaping and smoking to create community awareness. That seemed like the major focus and strength that the team wanted to create awareness for public health. And what were some of the common challenges? I guess with challenges, well, one, I don't think it's a challenge, but some of the health departments seem to still be working on potential ordinances. So still creating the work to get to the overall goal.
Long time. Yeah, they take a long time to do this work. Thank you so much, Tanya. How about another group?
I can go. So I was, I think, with group 3. Joanne, Frida, Margaret, Kendra, and I think there's a couple of people who popped in that I didn't catch as they came in and out. And so we had a couple examples of successes. And so one was a local health department working with a community center to implement tobacco smoke-free policy. And the success was that they had a champion that was integrated with their city council who advocated for the group. And with that specifically, they didn't have too many challenges, but then when they went on to adopt similar policies with other places, it was challenging because of a lack of that champion or advocate. And the second example we had of a success was basically with the Champaign-Urbana Public Health District, they did a dental health needs assessment, excuse me, where they were trying to identify exactly how many Medicaid accepting dentists there were in the county. And they found that the current lists were had not been updated since before COVID. And so the success is that we actually determined the real number of practicing dentists with the different caveats and all of that, and then we can use that to benchmark against for the future. Some of the challenges that we talked about, there was a few. So others in the group, if you feel like sharing, you can. But reporting cycles. So some partners have 3-year reporting cycles, some have 5 reporting cycles, some have 1-year reporting cycles, and then that's matched with your big grant surveys like Places and their different reporting cycles. So everything is kind of mixed up as far as who's reporting what. Staffing changes and turnover. The example I gave was that 5 years ago, the people who wrote this plan, they aren't working in the positions anymore, so they're not as accessible to help us between plans. and then time commitment to dedicate to building these plans, and funds available for implementation. So when we come up with really good ideas, which is what the iPlans are designed to do, how do we then fund those good ideas?
Yeah, thank you. And you mentioned a really good point that data is so important. So we've heard how important champions are and data, and really even some of those legacy folks who are involved in creation. Any other groups want to share?
Well, I'll go ahead and talk. I was with group 2. We were talking and we had George who was in there, and he is from Rock Island County. So he is actually spearheading an initiative to try to present to the board there, to the county board, to get the Kratom banned in the county, because they have had at least there's been 1,150 deaths from kratom, and it's just available at these vape shops and stuff like that. It does give like opioid side effects and stuff like that. So it was educational to speak to him.
Yeah.
And that's definitely something that is an initiative that to pay attention to, that I might want to even present here in my county, which would be great, because we do have an overdose initiative here that we partner with the Rossi and the Step Recovery Center that we have here for overdose prevention here. And then we also spoke to Cook County. They've continued like other programs to make sure that people have food and mental health, programs that of course were started during the COVID era, ended about 2 years ago, but other programs have taken its place to make sure that those services are still in place for the community. Community health workers was another big discussion. They play a huge role right now, and they're changing they're changing the face of how community work like looks, and how we can get there, right at eye level with people and what they need. But of course, it's funding. Funding and staffing will always be the issue to try to get these things done. Wonderful ideas and great initiatives, but we need the funding and the pass through of it.
Yes. Yeah. And, all of everything that we're talking about in this webinar, we are very aware of the environment we're in right now and the challenges related to funding and policy change and all of that, narrative change, everything. So it's very complex. Thank you so much. Does anybody from the last group want to share? All right, well, that's just fine. We will just move on. I know we are just about ready for our break. And so I just want to mention a couple slides before we take that break. There's obviously lots of folks who are involved in policy systems and environmental change, from economic, education, parks, schools, communities, families, all the government bodies, work sites, senior living centers, detention centers, daycare, police, just so many folks. So really thinking about who all those potential partners are. And here's some another resource on just some important considerations as you're thinking about policy systems and environmental change, and a reminder that they're really only successful if you have those champions and if you have community driven and community led initiatives. And then I've got a couple slides on social change roles that folks could play, and so you'll see those when you get the copy of the slides after the training. But we're going to go ahead and take a 5-minute break here. So my clock says 2:01. So just set your timer for 5 minutes. We're going to start right back up in 5 minutes, but give you time to take a bio break. And when we come back, we're going to hear from Jamie Bird with the Egyptian Health Department. So thanks, everyone. We'll pause here. Don't log out. Just pause your system, turn your camera and microphone off.
For those of you who just got on the training, we are currently in a 10-minute break.
5-minute break. Just a
My
5-minute.
apologies. My apologies. 5-minute break.
We're going to start back up at 2:06. Okay, I hope everybody had a good, quick break. And we're going to start back up. And I'm really happy to introduce you to Jamie Bird, Administrator of the Egyptian Health Department. And he's going to share a little bit about how they have really engaged the community and formed a stronger collaborative for community power. Jamie?
All right, yeah, good afternoon, everybody. For those of you that were on our last training that I did, this is essentially the same thing, so I apologize if you hear a repeat. What I want to talk to you about really is coalition building and how having an effective community health coalition can really benefit you when you are in your I-plan process, and among other things that it can benefit as well. So, as Lori said, I'm from Egyptian Health Department, and we are in the deep southeast here, southeastern Illinois, Saline, Gallatin, and White counties. So we're a tri-county health department. And our coalition is called the Southeastern Illinois Community Health Coalition. We were formed back in 2008/9. Southern Illinois Healthcare, that's a healthcare district that covers hospitals and clinics throughout Southern Illinois, Southern Illinois University Carbondale, and the 7 health departments you see would cover these areas. Met in February 2008, discussed the formulation of the Healthy Southern Illinois Delta Network. You can go on, Lori. Next slide. Okay, so our first planning meetings we were directed through that Healthy SI Delta Network to go back and form our own local community health coalitions. Some counties like Jackson County already had an effective one. We did not, but our first meetings in November, we kind of laid the framework for creating a new coalition, something we needed to do anyway. Main players were hospitals, our Wabash area development, some pharmacies, Southeastern Illinois Community College as well. Okay. So part of laying out a coalition, and I'll share this information. I'm sure these slides are going to go out, so I don't want to spend a lot of time on this, but anybody on here that wants more information on the actual formation and the process and all that, just call me or email me, and I'll be happy to go over this further. But we did lay out a leadership structure. I mean, for those of us in IAPHA, it's kind of laid out similar to what that is. We have bylaws that were enacted. And our first event was held all the way back during the H1N1 days, which most of us have long forgot about since we had to go through COVID since then. And then we officially renamed ourselves as the Southeastern Illinois Community Health Coalition. And we are organized as a tax-exempt 501c3. Okay. And you can see that our mission statement is that we'll have an active interest and commitment to improving the health of the communities in Southeastern Illinois. And our main goals are to provide leadership and a unified, that's a key word, a unified voice at the local level. And one of the first things we did is to appoint an I-plan team to take a look at our local health data and help the health department update our community health plan based on the statistics, local knowledge, and also surveys that we send out. So our current I-plan from 2021, which I'm sure has some similarities to most everyone else's, our priorities, and we're just starting our 2026 one, substance use and abuse, mental health and mental disorders, overweight and obesity, commonplace, I'm sure, throughout the state of Illinois. So one of the things we did is we formed action teams within our coalition. Our coalition is a general coalition. We represent over 25 different organizations. We have around 40 to 50 very active members, and a lot more that are on the periphery that actually work through our action teams that may not be a part of the main coalition, but they're a part of the action teams. We have a emergency preparedness, that's through our Shawnee Preparedness and Response Coalition that meets quarterly here in Southern Illinois. We have a healthy lifestyle action team. That's really with our obesity and overweight. That also, we're a part of the Southern Illinois Cancer Action Network. We have a Diabetes Today resource team. Those feed into that healthy lifestyle. Healthy Minds, Healthy Lives, which is our mental health and mental health issues team. We also have a suicide prevention task force that is a part of that. And then also our SI support, our Southeast Illinois Substance Use Prevention, Recovery, and Treatment Group. That's a part of a recovery-oriented system of care, or ROSC. And you can see some of the subgroups that meet under that as well. And that SI support group has been really, really valuable as a part of our overall coalition. Okay. You can see, I'm not going to read off all these accomplishments, just different things we've worked on over the years. We did a quarter marathon for many years for fundraiser. We've had a real good luck with Walmart and some grants. We were able to do community health garden with a grant, colon kit pickup. Just recently, we've done some other things, including buying some car seats and having an event through that. So, thank you. Go ahead. Okay, so just as far as I plan, so we're due in September of 2026. We generally try to start ours 14 to 15 months ahead of time. So we met initially in June and worked on developing our health priority survey. And I'm not sure how many people, we use kind of loosely, but we do use the MAP process for working on our iPlan. And part of that is that we developed a survey and we want to get that out to as many community members as possible. Part of the problem we've had in the past with community surveys, especially when you're using social media, is they tend to trend not being very diverse in the people that fill them out. We end up with a very female heavy, college graduate heavy, less diverse population. So part of the challenge is to try to get that survey into the hands of people that don't meet that criteria, that you're wanting to reach out to the less socioeconomic privileged and diverse, ethnics as well. And so we are also doing hard copies of those. One of our SI support events we do at different laundromats, we do laundry days where we go and people can bring their clothes and we do their laundry for them. And we do those in all of our communities. And we've started taking hard copies, of our surveys with us. And we got, I believe, 25 a couple days ago at one of our laundry events. And we think that, that really worked out well. We've taken them to our local housing, to some of our senior groups. We have different senior groups that meet, or they do Meals on Wheels, things like that. That's a different strategy. If any of you have any other better ideas, we're trying everything to try to get this more diverse participation. So that's what we're currently doing. Other things we're working on right now are compiling the different strategies and activities that have been implemented since 2021 that are related to those health priorities. We've created another survey. I know we all get sick of surveys, but they do serve their purpose. And that really is for our local partners and our community health coalition members to just make sure they share, so that when we finalize our iPlan, everything that's being done throughout our 3-county area is listed in there, so that we're certainly want to make sure and include all the help that we're getting. And then of course, just like everyone else, we'll be compiling data from a variety of resources, the BRFSS, Cancer Registry, County Health Rankings, Spark Map, which is really, really good if you're not familiar with it. Okay. Okay, and just other things, once we get down the road, we're probably going to run our let's see, online using SurveyMonkey. We're probably going to run that through the end of September. I think as of this morning, we had 253 so far, which is a good start. We had about double that for our 2021. We'll take a look, we'll compile all of our information, and we'll work on finalizing our goals, objectives, and potential strategies for the next 5 years. Try to complete it in May of June of next year, present it to our Board of Health. And then after that, we actually present it to the coalition at our general membership meeting, which is in August of every year. We'll invite the media to that and try to make a big event of it. We do an in-person luncheon for our annual meetings, which is next Wednesday of this year. And then hopefully, knock on wood, everything willing, we'll be able to send that to Joanne in late August next year for approval. And anybody has any questions on any of this, you can ask them now. And, most everybody should have my email or my phone number, or ask me in person at, administrator meetings or whatever. I'm happy to share. We certainly don't have all the answers, but this has worked pretty well. I'm in my 6th or 7th iPlan now, and I certainly have improved a lot since the first one. And where to work, just continue working on that, try to find more funding opportunities. We are a 501c3. We try to do things in the community. And when you want to do things with your community and in your community, you've got to have some funding to be able to do it. Increase and diversify our membership, include the business community. They can be invaluable to you, and try to keep the motivation high within it. COVID really hurt our participation. We've had to work to rebuild up our coalition since, and don't let people become complacent. Ask everybody to participate. I think that's all I have.
Thank you so much. Anybody have any questions for Jamie?
I have a
And
question.
Samantha, go ahead, Amanda.
Yeah, Jamie, I have a couple questions. First of all, and sorry if you said this and I just had a zone out moment. I struggle with that ever since COVID. But did you mention who holds, I realize that the 501c3 is the group, like the community group, the task force, the coalition, but who sort of manages that on the back end? Is that your health department kind of as the chief health strategist behind the scene, or is that held sort of in the hands of another CBO on the team?
That would be the health department. That would be us. I mean, right
Okay.
now, I mean, I'm current president, and we have a treasurer, and we have a full array of officers, especially since we're a 501c3. We have to file annual reports and do a 990N, and we have a treasurer here at the health department that keeps all the books and records for it. Now, I mean, that treasurer could change, just like IAPHA. It doesn't have to be someone located within the health department, but the framework of the organization is ran through the health department. Yes.
Okay. And then I'm just curious, like you said, you've done 6, 7 iPlan cycles. What's one or two of like the biggest things you've learned or felt like you've gotten better at? I'm thinking like maybe some of our newer colleagues on the line that might benefit from hearing that like it takes a hot second to get comfortable doing iPlans.
It does take a hot second. I mean, I'm still not very good at it. I'm lucky I've got a good team of people that work around me that push things through. Coming up with a just good practical survey because even though statistics are going to tell you the story. Number one, statistics between 1998, when I was preparing for my first one, and now are so much better and so much more up to date. We used to get statistics. We were using 10 and 12-year-old statistics back then. Now, you're getting up to date stuff on county health rankings. I couldn't encourage enough for people to look into the sparkmap.org. It is a great, great tool. Please check that out if you haven't already. And, I'm not promoting them, but SurveyMonkey has been a godsend to a lot of us. It allows us to use social media to get out there, and we got a QR code and a link and stuff, and just really making a lot of progress within your community and getting the community to support you and help your effort, I think, is invaluable.
Oh, thank you.
Any other questions? Jamie, would you mind putting your email in the chat in case folks want to follow up with you on anything? And thanks again for a great presentation and sharing your insight. Really
Okay. Well,
appreciate that.
We'll throw around that word great too loosely, but it was adequate anyway, hopefully. So thank you.
Absolutely. All right. I've got a slide in here on just some guiding principles for transformative partnerships and just some key things that are a little different when your focus is on transformation that you want to think about. So I'm not going to go through all these, but really this goes along with a slide I'm going to share in a minute about equity being both an outcome and the process. So when you look at these principles and you think about these principles, think about it really acting in an equitable manner and part of equity as a process. So again, I'll leave this in here as a resource for you as we move on to start talking about power dynamics and get ready for our second breakout group discussion coming up shortly. All right, so what is community power? And it's really just the ability of communities most impacted by structural inequity to be able to develop, sustain, and grow an organized base of people who act together through democratic structures to set agendas, shift public discourse, influence who makes decisions, and cultivate ongoing relationship of mutual accountability with decision makers that change systems and advance health. That's what we're really trying to do is be able to make those shifts. And it's all about relationship building. It's all about narrative. It's all about the stories that we tell and being able to gather more people in to create that power and to show that these types of changes will make an impact. These types of changes will save money. Those are the things that are important to the policymakers. So, as I mentioned, equity is both a process and an outcome. We think of it a lot as an outcome. It's what we're trying to achieve, but there, really are these foundational pieces. As an outcome, equity results in fair and just access to opportunity and resources that provide everybody the ability to thrive. But as a process, it requires a new way of approaching our work. It prioritizes access and opportunities for groups of people who have the greatest needs. So I loved hearing the way Jamie is ensuring that they're getting surveys through actually serving people by doing, laundry for them and being able to access people who need to use a laundromat or something in order to get their clothes washed. So reaching those people in that way, but reaching people who may not have an opportunity to be heard otherwise. So prioritizing that for a variety of different groups of people. As a process, equity also methodically evaluates benefits and burdens produced by systems that seem as though they're neutral, or practices that would seem as though they're neutral, but they unfairly disadvantage some and advantage others. As a process, equity also engages those who are most impacted by inequities as experts in their own experiences, strategists in co-creating solutions, and evaluators of success. So it's not just engaging folks at iPlan time to find out what the needs are, but also to have them engaged in identifying solutions to those priorities that they've helped to determine and identify. What are the solutions? What are the things that they are experiencing that they need? What are those potential solutions? And then engaging them to see, is it working? What's working, what's not working? And they can tell you, because again, it may be working for some population groups and not for others. And we need to understand that. I love this quote from Martin Luther King Jr. Power is the ability to achieve a purpose, whether or not it is good or bad, depends on the purpose. So a lot of times when we hear power and we're talking about power, it doesn't really resonate with everyone. So we might have to use the actual definitions if that word doesn't. But we want to be clear that it really depends on the purpose. We're talking about concepts of power. There's power over, power to, power with, power within. So we're not trying to have domination or control over one person or group or institution over another. The power to is the power to individually act. Communities have the capabilities, the capacity to be able to achieve their desired results. Power with is really that collective action, the ability to act together and build alliances with other groups and sectors coming together to achieve common goals. And power within is individual or collective sense of self-worth, value, and dignity. So there's quite a few pieces here that are important to consider. We also want to take a look at the faces of power. There's visible power, where, there is a body that is appointed to exercise influence in the political or public arena and among formal decision-making bodies to achieve a particular outcome. So your city council, school board, the legislative body, all of those types of things are visible power. People have been elected, they have been put into positions to exercise that and to hopefully represent the people that they're serving and vote on their behalf. That's the visible power that we're used to seeing. But there's also hidden power. And this is those who can, be involved in decision making. They can influence decision making. It's organizing that decision making environment. Community organizing, this is a, big piece, the hidden power and how much impact that this can have. People who can really access decision making and understand the issues that are being considered by decision making bodies. And then invisible power is that which shapes the information, beliefs, and worldviews about social issues. And I was talking about the water that we swim in, and sometimes we don't really even notice the water, right? What water is around us. But it's all of those things that are shaping and influencing those beliefs and worldviews and about social issues and about people. And it's part of this invisible power is part of the narrative that we're trying to or need to shift at times to help us be successful with policy systems and environmental change. So process steps to advance equity, really, it's very important that we're thinking about understanding and naming those underlying root causes of the issue. What are the social and structural determinants of a particular health issue? What are the written and unwritten rules that are holding and keeping the conditions for that in place? What are the values, the beliefs, the worldviews, the culture, the norms around that? Governance, laws, policies, regulations, institutional practices. I would say that looking at those things is one of the biggest changes for me over the years in iPlan, because it's not just looking at the health status data, but it's also exploring through surveys, discussions, your community advisory committee. It's exploring what that narrative is, what those values, beliefs, cultural and norms are holding things into place. Who are the decision makers? What are the laws and policies that are holding certain conditions in place? What are the institutional practices that are holding social and structural determinants in place? So I would say that's also one of the biggest changes I've seen in iPlan is that there needing to have more of an emphasis on that data as well. The next step in advancing equity is really conducting a power analysis to understand what the equity agenda is and what the opposing agenda is. So who's working with you on this equity agenda? What's their perspective on it? And what's that opposing view, that opposing agenda? Understanding what it is and plotting your stakeholders to see where they are and what level of support you may have versus what level of support you need to get some change. And then really working on shifting that narrative, breaking power by exposing narratives that focus on individualism and unmasking dominant narratives that can help lose power in those dominant narratives. Building power by developing transformative narratives, that's what we want to focus on, that really amplify the values and beliefs of interconnectedness, belonging, and a different set of values and beliefs that actually help us hold together positive changes in policy systems and environments that will help us realize what change is possible. And then finally, moving to action. So identifying what actions you can take to address the structural determinants of health that are holding things in place. What are you currently doing that you can shift in order to focus more upstream and making some of those tough decisions? And what new work can you start? So I know that a lot of us are grappling with some of the funding losses and changes, and we still have to keep staff employed. But maybe it also is an opportunity for us to think about what programs we may not need to continue doing, or we may be able to pause while we put some efforts more into work that doesn't require a lot of buying supplies or purchasing certain things to implement a program, but may focus more on the time of an employee and working on shifting those narratives, relationship building, and working on policy systems and environmental change. It's maybe presenting an opportunity for us to do some of that at this time. Here's an example of a power analysis that I wanted to share with you. And it's not something that I have time to really dig into, but this is a great tool that I think is pretty self-explanatory. I have the reflection questions, and like I said, you plot people who are working with you on an equity agenda and people that really are opposing that agenda, and see where they're at and where you need them to be. And then here are examples of strategies and actions that can help shift power relations. We've talked a lot about these, changing that narrative, building relationships, building the infrastructure, working on legislative agenda and organizing folks. And here's a nice example of food justice initiatives. So you can see at the bottom of this arrow, interventions into the social determinants of health, and at the top of the arrow, interventions into the structural determinants of health. So at the bottom, providing food, making sure that we have food pantries, we are doing food giveaways, that there's opportunities for people in food deserts to get the food that they need for food justice work. Increasing budgets and food subsidies for SNAPs. That's even more important right now with the new policies that are coming out, and the work that's happening now, changing laws about income and food prices, to ensure that there's a match there. Organizing people facing food insecurity to come together, to work collectively, to identify the needs, identify the issue, the system change that's needed. Sometimes it's as little as when food giveaways are done, or policies around being able to access a pantry or whatnot. But building coalitions between groups who are advancing food justice, organizing those folks across racial and other dimensions so that they can share and also have unique identities and come together and be able to share that. And then changing the narrative, changing that belief that food insecurity is about individual behavior. That is a narrative that needs to be changed so that we can do work in policy systems and environmental change to improve food access for everyone. So with that, we're going to break into our final breakout session here. And when your group turns into your breakout group, you can choose any issue, anything that you have in your iPlan or issue that could be food insecurity, housing insecurity, community violence, substance use, overdose prevention, whatever it is. And all I want you to talk about is what dominant narratives are standing in the way of policy change for that topic that you've selected, and what transformative narratives would help make room for progress. So again, we're going to do things the same way in small groups. You will have someone at the top of the alphabet who's second in line this time, second in line at the top of the alphabet, who will kick off the conversation. Even if you just ask the question of the group, you may not have one to share, but you'll kick it off by asking the question. And you don't have to have anybody take notes this time, but the person who's second in line in alpha order by first name, you'll kick off the conversation. And we're putting these in the chat, these questions, and we're going to launch those breakout groups, and we'll come back together at 5 minutes till the hour, because we need to have you take an evaluation poll and share a couple updates. But we are just going to take a few minutes, let's see, 37 to 55, however many minutes that is, till 2:55 in breakout groups. So Samantha, you ready to move us?
Yep.
We might just have 2 breakout groups, I think, with the number I'm seeing. 2 or 3,
Oh, yep,
okay.
yep.
Whatever you need. Looks
Okay.
good.
Yep.
Thank you. Sorry
I'm
about
gonna-
that.
No, it's okay. I didn't want to be on video. My roommate's making a call in the other room. So I was like, yeah, but she's fine now. I'm gonna go into the second breakout group and go check in on them, and Jasmine's in the first. So
Okay, thank you.
no problem. Hey, Lori.
Hey, how's
Hey,
it going?
what's up? Good, good.
Are they
We, s-
having good combos?
yeah, actually, it took my group a hot minute to get into it, but now they're talking.
Oh, geez, because they couldn't decide which topic.
Yeah, they just couldn't. It was like, nobody wanted to be the first one to talk. But now they're down to 4 people.
4 people. How
Yeah,
are they down to 4 people?
like
One
at
of them
least
is
3
Frida.
left.
Yeah.
Yeah. We have about 6 minutes left in groups. What do you think?
That's, well, as long as they're talking about these things. I mean, these are really heavy questions. You know what I mean?
I know. It looks like Joanne's the one talking in the other room right now.
What?
Yeah.
I'm gonna pop in. I'm
Okay.
gonna pop in.
Okay. Sounds good.
Grapple with. These are really tough questions to, tackle, but I do really think that they're beneficial for you to have in a really honest way with some of your community members, whether it's your iPlan advisory committee or whatever group. But when you're working on a priority issue, whatever that priority is, really getting very honest and saying what is the narrative, the dominant narrative in our community with policy or with policymakers around a particular issue. Is it that drug users are, have low morals and are valuable people? Not that I think that's true. I'm just giving an example. An example from another group is that, zoning is bad because I don't want people to tell me what to do and don't need to be able to, do anything with zoning because it's our land or whatever the case may be. Um, but whatever the issue is that you're working on, you really need to be able to get very honest about what those dominant narratives are and how do you need to change that narrative, that message. So being able to say you have to educate people or just have to do more of that. What's the message behind that education? What does that narrative need to change to? And really getting very clear on that and then strategic and crafty around how could we get someone to change this narrative? How can we shift this narrative? What type of messaging will need to be done? Who are the storytellers? What type of stories do we need to collect? How do we resonate with people that have maybe completely different values or beliefs about something or to be able to do this? So those are questions that I really encourage you to take back. Unmasking those dominant narratives is not pretty, it's not easy, but they are real discussions that need to be had. And then being able to build power by developing transformative narratives that can amplify values and beliefs that focus more on interconnectedness and belonging. That what's good for the least of us is good for all of us, and helping people to see things a little bit differently. So thank you for that discussion and all of the work that you did there. We've got our final poll question, and Samantha will put that up. That's just to give some feedback on the training. And this training has been recorded, will be posted on the iPlan website soon, and we'll be sending out the slides. So if you have someone that could benefit from the training, please let them know how they can view the recording. You'll see the poll. You should see the poll on your screen now. And there are just 5 very brief questions. This will only take you a minute or two. And if you use the time now to take take that survey, that would be helpful for us. we do have another technical assistance session with IDPH on September 25th. And we have another iPlan training on October 30th, managing the community action cycle. So we encourage you to tune in if you're interested in either of those.
And Lori, I'll put the shameless plug in only because I'm on the advisory committee and maybe you don't want to say it, but it's my understanding you need this feedback for like the grant deliverables, like you need the survey.
That's right.
So that we can we can hang on to what little money we still have in public health. That's so like everybody needs to take the survey so we can keep your money. Is that right?
That's right. That's
Okay.
right. Yes, thank you.
Go ahead and do it for you. It's fine.
Thank you. Yeah, we don't have many who stayed on, but the few of you who did, if you can complete this poll, that would be great. We've got 2 more minutes carved out here with you to complete this. 4 of you have done it. If there's anybody else that can complete it, we appreciate it. Your responses are anonymous, so no worries there. Once you've completed it, you are free to go. As I mentioned, we'll be sending out the slides, and there's a lot of great resources in there on the resource page. So check those out. And thank you so much to Jamie and Samantha and Jasmine for their help, and all the participants for your active participation. I really appreciate you.
Thank you, IPHI.
Thank you, everyone. Thanks, Lori, for a great presentation.
Thank you.
Okay, I think that's everyone. I'm going to go ahead and close the Zoom.
Okay, very good.